in Kansas. I actually was born not too far from here in Kansas City, but on the Missouri side. My first time in Kansas, and I'm sorry, I didn't plan that. But it's a beautiful place, and I've just enjoyed meeting the people that I've met since I've come here. And so thank you very much. You heard a little bit about why. I was going to start out by kind of telling you why I do this work, and it was really a process, an awakening as I was practicing medicine and kept running into barriers to what I thought kept me from practicing quality medicine. I'm the first doctor in my family. I graduated at the top of my class in university. I graduated with honors from my medical school. I went to Johns Hopkins and I thought, great, I'm going to go out and practice quality medicine. And then I found out that insurance administrators were deciding what my patients could and couldn't have. People that had no medical training at all. And it just wasn't right. So what we have right now, there's another pediatrician who I really adore, Dr. Donald Berwick, and he's head of the Centers for Medicaid and Medicare Services. And he says that systems do what they're designed to do. So if we say that we have a healthcare system in the United States, what it's designed to do, unfortunately, is not create better health for our population. It is designed and doing very well to create more profit for the industries that are healthcare industries. The situation that we're in the United States was really never intended to become a system. It was really an accident of history. And back in the 1940s, when we saw many European nations after World War II creating healthcare systems as part of their recovery packages, at that time the United States went in a different direction. We actually linked health insurance to employment. And that wasn't really meant to be the basis of a system. It was really a reaction to the fact that wages were frozen and employers needed another way to attract employees. In the 1980s in the United States, we took another step that put us in a direction that took us away from really health. And that was when we started to privatize healthcare. And we saw the Department of Health and Human Services use public dollars to bring investors in and train them on how to take over healthcare. So Solomon Smith Barney and groups like that were learning how to make a profit off of healthcare. And since that time, I don't have slides to show you today, but it's really dramatic how we see a real steep rise in healthcare costs start after that, and then a rise in the number of people that are uninsured. So what are the consequences of the kind of system that we have right now? Well, the United States has I guess we're distinguished as the one place that we're top in the world is the amount of money that we spend on healthcare. We spend more per person per year on healthcare than any other industrialized nation. And in many nations, we spend twice as much as what they spend, and they actually cover pretty much everybody and have better health outcomes. We have a growing number of uninsured. We just saw the new numbers for the 2010 census data. Another 1 million people became uninsured last year. The year before that, it was over 4 million new people that became uninsured. We're seeing a drop in the number of people that are being offered insurance or can afford insurance through their employer. And we're seeing a rise in the number of people that are underinsured. So these are people that pay for their insurance premiums, but when they have a serious accident or illness, they find out that they're not able to afford the care that they need. They're vulnerable to bankruptcy. I mean, if you think about it, do you know of any other nation where people have to have bake sales and fundraisers when somebody gets a serious illness? It just doesn't happen. And in my neighborhood, there was a woman who developed cancer, and her husband had to take on a second job in order to pay her medical bills, which at that time of her life, really, he would have been much more useful at home with her and where she needed him. So these kinds of health injustices are happening in our country. And in many cases, we're not aware that they're health injustices because we don't see what happens in other places. The number one cause of bankruptcy in the United States, over 60% of personal bankruptcies, is due to medical costs. And almost 80% of the patients that go bankrupt from medical costs have health insurance. Many of them maintained their health insurance throughout their illness but still went bankrupt. Last year alone, 29 million people used their entire life savings for healthcare costs. And we have a growing number of people who have unmet health needs. We so often hear about rationing. Well, those other countries that have healthcare systems, they ration. Well, we ration in the cruelest way here. We ration care based on the ability to pay. And we have self-rationing now. We have about 50% of people in the United States who don't get necessary care because of the cost. Not really a way to have a healthier population. And then finally, as a result of the way things are, we're seeing really an impact on our businesses. Healthcare premiums that businesses pay have been a leading factor in the stagnation of wages. You know, we see our unions fight to maintain their health benefits, but any raise they get is eaten up by increased cost sharing for their health premiums. We see that our competitiveness on the global market is hurt. We see, you know, our car industry moving into other countries that have universal healthcare systems to manufacture their cars because they were spending $1,500 per vehicle on health insurance. More than they spent on steel was spent on health insurance. And it really kills our entrepreneurial spirit because people are tied to their jobs. They worry that if they leave their job to go out and start a new business, they won't be able to afford health insurance premiums, or they might lose their insurance because they can't, you know, they have a pre-existing condition and they can't get another insurance. So it's really harming us in many ways, the situation that we're in right now, and that's what drives me to do this work. Now, we passed the Affordable Care Act last year, and some people say, is that a good thing or a bad thing? And I can tell you that there's really arguments on both sides, so I don't have the wisdom to tell you if it's a good thing or a bad thing, but I can tell you that it didn't solve our problems. I can tell you that when it's fully implemented in 2019, they anticipate that we'll still have half the number of people that are uninsured remaining uninsured. That's tens of millions of people remaining uninsured. It's going to increase our healthcare costs through added bureaucracy of the health insurance exchanges, through having to enforce a health insurance mandate, and through having to regulate insurance companies and follow up and try to make sure that they're actually doing what they're supposed to be doing, which in the state of Maryland, we've had a very hard time with that. It's actually going to continue to increase the number of underinsured people. As more and more people are pushed into these health insurance exchanges, they're going to have to, because they didn't control the cost of health insurance premiums, we're going to see people buying the lower benefit plans, and that's going to leave them vulnerable when they have a serious problem. And while we anticipate that we will also continue to see a decline in employer-sponsored insurance, because there was a report in a business journal where they were pretty honest. They said, well, no business wants to be the first one to dump employer-sponsored health insurance, but everybody wants to be second. So, as a doctor, we try to be scientific and we look at, studies and what works and what doesn't. We now have tens of years, many decades of experience with this current health system. And the evidence is completely clear. It's too expensive and it leaves people out and it's not improving the health of our population. I didn't mention our health outcomes. I could go on and on about how our health outcomes are. But I think one study sums it up really well. They looked at 19 industrialized nations that they could compare, and that if each of these nations functioned as well as the top 3 nations, which are Japan, France, Japan, and Australia, they found that the United States did the worst in the number of preventable deaths, that over 100,000 people per year would not have died if we had a top-performing health system. Now, in the United States, we're so often trying to be the best. Why aren't we trying to be the best when it comes to health care? So, what is single payer? What do I advocate for? I came to this because as I was trying to figure out what was going on, I looked at what had been tried, and I found that we've been trying all these little partial solutions, like we'll give a little tax break here, or we'll expand a little Medicaid there. But none of these solutions was moving us forward. In fact, we continued to fall behind. So that's when I learned about Physicians for National Health Program, and it just made sense. It's based on the evidence of what works. It's based on traditional Medicare, which has worked very well. It has flaws. That's why we call it improved Medicare. But it has lifted seniors out of poverty. It has improved their health status. When people turn 65 and go on to Medicare, their health improves. So single payer basically does 2 things. It creates a health system that's based on health. Sounds simple, right? So we start taking our health resources and looking at our needs and determining what's the best way to use those resources. And it allows us to use our health dollars in the most efficient way. What I didn't mention is that part of the reason our healthcare costs are so expensive is because we have huge administrative costs. A third of our healthcare dollar goes to marketing and administration, and these are things that have nothing to do with health. Traditional Medicare spends 3% on its administrative costs, so 3%. We found that we would save about $400 billion a year if we went to using a single publicly financed fund for our healthcare. And the other thing that insurance companies do, which is a problem, is they cherry pick. Have you guys heard of that term? They try to only cover the healthy people, and then people who have actual health problems often get put into our public programs. So what single payer is it's a single system that everybody's in from the time that you're born until the time that you die. It makes a lot of sense because when you have to restrict people and decide who's eligible for what, who's eligible for this, it's really expensive to do that, and a lot of time and energy is wasted in trying to determine that. A single-payer system would be fairly financed. The United States is ranked 54th in the world for fairness in financing of healthcare. We have very regressive, so if you look at someone's income, the lower their income is, the more they're paying as a proportion on healthcare. It's comprehensive. We think that all necessary health should be covered, and we include vision and dental and mental health and long-term and prescription. Our dental outcomes in this country are really, in many ways, third world. It's really striking. It's simple. Right now, trying to use the system that we have is very frustrating for patients, figuring out where you can go and what treatment you can have. It's also very frustrating for health professionals who we have to spend a lot of time dealing with paperwork, dealing with authorizations, and that's time taken away from our patients. And that was really the last straw for me when I was told that I had to spend less time with my patients and that if they had a second problem, I had to tell them to reschedule to come back to talk about the second problem. So I'm going to tell a parent, you have to go take off work, take your child out of school, and worry for another week so you can come back and talk to me about that. Just wasn't acceptable at all to me. So it's simple. It's one set of rules, and it's rules that we're aware of. Like right now with the insurance companies, their rules are all different, and they change arbitrarily, and it's really hard to keep up with them. A single-payer system gives us choice. We heard during the health debate, President Obama kept getting up and saying, Americans want their choice of health insurance. Americans don't want their choice of health insurance. They want their choice of doctor. They want their choice of treatment. And those are the things that private health insurance restrict through their networks and through their authorization processes. So this gives you the choice to go where you want to go for health care. And if you're traveling around the country and you have a health problem, you don't have to worry that you're out of network. You can get care there. It creates the kind of competition we actually want to see, which is where health professionals are competing to be the best quality so people want to come and see them. That's not necessarily happening right now. A single-payer system would allow us to really focus on preventative care, but also, I think, timely care, which is hugely important. We have study after study that shows that when you have a copay or a deductible and you make a financial decision about whether to seek care, that people often avoid or delay getting care that they need. And it actually crosses all socioeconomic status levels. So nobody's really good at determining what care is necessary and what care is not. So we want to remove those barriers, and under a single-payer system, we would pay through our taxes, but we would not have to worry about copays and deductibles. It would create a system that we can go and use. It's like a beautiful thing. And the other two things about it is that it would be transparent because it's publicly financed, and it would be accountable to the people. These are really important. So after the legislation passed in 2010, those of us who work in the single-payer movement, and it was a really tremendous year for the movement because there was a lot of growth, a lot of people that came out, worked really hard to try to push to have this heard. Around the same time that the bill passed, the president created something called the National Commission for Fiscal Responsibility and Reform. Have you guys heard of this, the Deficit Commission? And they were supposed to find ways to deal with our national deficit. And when we looked at who was on that commission and who was backing it, which was the Pete Peterson Foundation, a private foundation that has for decades tried to get rid of our, what they call entitlement programs, we call them social insurances. We were very concerned, and so I and others in the single-payer movement went and testified before the Deficit Commission on why they should not look at cutting our social insurances like Medicare, but actually they should look at expanding our Medicare to everybody and improving it. And if you want to read that testimony, it's on the website, PHP. But basically, our healthcare costs in this country are growing way too fast. They're growing faster than our GDP. You may have seen that in the news just came out recently about health insurance premiums for employers. Sponsored plans rose by 9%, but wages only rose by 2%. That's the trend that we've been seeing for a while. That actually, health insurance premiums are rising on average 3 times faster than wages and 4 times faster than inflation. It's estimated that at this rate, and this was done by Uwe Reinhardt at Princeton, an economist, that in 2025, our healthcare costs per person and our income, average income, are going to meet. So it's just not sustainable. And the effects of our healthcare costs, as I said, it's bad for business, it's bad for families. If they don't have discretionary funds to spend on other things that help the economy go, it's just bad. So what the Deficit Commission has been looking at is ways to cut Medicare. And we think this is really the wrong approach because the pressure on Medicare exists because we don't have a healthcare system that controls healthcare costs. So of course, every part of that system is under stress. We really see Medicare as more of a victim of not having a healthcare system that controls costs effectively. And when you look at the rise in cost of Medicare compared to our rise in costs on the private side, we see that Medicare does much better. It's growing much more slowly. So that's not the thing to go after if we want to actually solve our healthcare problems. A national improved Medicare for all has proven cost controls. For one thing, the administrative costs that I mentioned, going from 33% to about 3%. But the other is that, and this is kind of a no-brainer, we don't have any real way of negotiating for fair prices for services in this country or for pharmaceuticals. And we actually spend the most on these things in this country compared to other countries. So when you have a national system, suddenly you have real bargaining power so that the pharmaceutical companies can bring their prices down. The other thing is that it allows us to adopt budgets. Every hospital and institution would get a global operating budget. They wouldn't have to worry about attracting patients with fancy, procedures and fancy technology. They would just know that they would have enough money to take care of the people in their community. And this is really important because we're seeing around the country that public hospitals that serve communities that don't have high incomes are being closed down, and that wouldn't happen under a single-payer system. So really, having a single-payer system would have a positive effect on our economy. It would allow us to control our healthcare costs, making it for businesses so they could be more competitive, relieving a lot of stress on our families, allowing them to have more discretionary income. It's also estimated that a single-payer plan, because of all these factors, would increase the number of jobs in this country. It would change the jobs. We'd have fewer people being insurance administrators. Many people have actually left direct patient care to become administrators because of their frustration with the system that's going on. They could actually move back into direct care. But the situation that we're in right now is really pretty serious. Medicare and Medicaid are under attack by both the Republicans and the Democrats. The Republicans are talking about creating Medicare vouchers so that instead of having guaranteed Medicare benefits, seniors would be given a certain amount of money to go into the market and purchase private insurance. Well, seniors haven't had to buy private insurance, full benefits, for a long time, 46 years in this country, and we estimate the cost would be very high. And the way that they fashioned it is that the rise in the subsidies would be less than the rise in healthcare costs. So over time, it would be a shrinking amount of money that seniors would have to pay for their healthcare. The seniors are already struggling with healthcare costs. For those who are under 200% of the federal poverty level in income, which is a large percentage of seniors, they're already spending 15 to 22% of their income out of pocket on healthcare. There's not very much wiggle room there to take on more costs. We see this new super committee is being tasked with coming up with legislation to address the deficit that's to be presented to Congress for an up or down vote. No amendment process. This is really stealing our democracy. And they've been tasked with cutting Medicare. They're not able to control our deficit. Again, it's just the wrong approach. They say that, oh, we're not going to cut services, we're just going to cut reimbursement. But when you cut reimbursement, it doesn't take much to realize you cut access to services. So for me, the reason that I do this work is that we're already spending enough money in this country. It's not a matter of money. If we spent the same amount of money on healthcare, on actual healthcare, we could cover everybody with comprehensive benefits throughout their life. So it's not a matter of that. It's not a matter of infrastructure. You know, we have hospitals, we have facilities, we have doctors, we could train more doctors, we need to get more doctors into primary care. And probably they would more move into primary care if we had this type of system, because right now we're not making it as primary care doctors. We're under a lot of pressure. And the majority of medical students actually go into medical school wanting to do primary care. But by the end, with their debt and the low reimbursement rates that primary care doctors receive, they have to make an economic decision, and more of them are going into specialties that are higher paying. And so we're really losing our primary care docs. But what's exciting to me is that for the first time in 10 years, last year in 2010, we saw more students choosing to go into primary care. And we think that might be because healthcare reform was on the table, and they probably thought things were going to get better. So they saw some hope. So I think if we can give them more hope, they'll come into more primary care. We actually have public support for this proposal. Polls have been done for decades now. Independent polls have showed clearly around 65% of people in the United States support this approach. And then the polls of physicians also show that a majority of physicians support this. There was a poll done in 2002, a national poll of physicians across specialties. It was repeated in 2007. In that 5-year period, we saw a 10% increase in the number of doctors that support this. It went from 49% to 59%. And my experience traveling around the country and speaking to doctors is there's really a level of desperation out there, and we're looking for solutions. And I think even more doctors are coming on board with this. We have the health policy experts. The Taiwanese system was the most recent single-payer system to be instituted in the world, and they used our health policy experts to design it here at Harvard and Princeton. So we do have the knowledge, but unfortunately what we found in Congress in 2009 and 2010 was that it wasn't a matter of policy or knowledge or evidence. It was completely driven by the industries, the health insurance corporations, the huge hospital corporations, the pharmaceutical corporations, and they heavily influenced, and some of them helped write the legislation to benefit them. There's a British journal called The Lancet. It's a British medical journal. And in December of 2009, the cover of their issue said that the U.S. government has proved itself to be incapable of enacting reform on the basis of evidence or the public interest. I mean, do you get any more blunt than that? So that's really what led to our action in the Senate Finance Committee, was that we were meeting with members of Congress, we were meeting with leadership in Congress, we were presenting them with the data, and initially they were very welcoming, and oh yes, of course, you should be considered, and we just said, we want two things. With everyone we met, we said, when you put your bill together, you compare it to our bill on the basis of how many people are covered and how much it costs. Just do that. And what we found is when the hearings started happening first in the Senate Finance Committee, and we asked if our experts could come and testify, and we looked at who they invited, and it was the CEO of Blue Cross, it was the health insurance lobbyist, Karen Ignani, it was the pharmaceutical lobbyist, Billy Towson, it was the head of the Business Roundtable and the Chamber of Commerce, and it was all industry and business, and it wasn't, like the health policy experts or the patients or the people that work in the system that kind of know what's going on there. So we asked, will you let us have somebody testify? And they said no. So we turned to our grassroots base, and we sent out emails, and we said, if you're in this senator's district, state, will you write the finance committee and ask them, or call them and ask them to include a single payer person? And we had thousands of emails and phone calls. We actually that we had a friend in the Senate Finance Committee office. And he was a single-payer supporter, a young man, and so when we called up, he'd say, "Getting lots of calls, keep it going." But on the Monday before that hearing, when we called him, we were told no more invitations would be issued. So there we were. We have the evidence of what works. We're being shut out. Do we just go home at this point and go away and say, "Gosh, we tried, darn, maybe next time"? That was not even an option for us. Because every day I hear stories, healthcare stories in this country, things that never should happen. And those people are counting on us. Everybody is counting on us. We're all counting on each other, right, to make this happen. So we went down there, and I never dreamed that I was going to stand up and get arrested. That just hadn't been in my kind of consciousness prior to that. But I was pretty upset. So, and actually my good friend, who's a lawyer, was one of the ones that was arrested. He's actually been working in social justice for about 30 years, so he has been arrested before, so we used him to tell us, what's it like and what are we going to expect. So we had these conference calls where he, prepped us. He was sitting 2 rows behind me, and he's going, so much that the woman sitting next to him said, "Are you okay?" And he goes, "I'm just a little nervous." And I'm thinking, I'm in front of him, and I've never done this before, and I volunteered to go second because I knew that if I didn't do it, I couldn't ask my colleagues to do it if I wasn't willing to do it. So it was pretty nerve-wracking, but, it did have an effect. And I was called by Senator Kennedy's committee. He was alive at that point, and I was the first person to testify in the Senate Health, Education, Labor, and Pension Committee. And we did testify in every committee in the House, every committee of jurisdiction. They didn't listen to us, but it went on record, so that was good. So what did I learn out of kind of that experience? And, we tried everything we could think of to have our voices heard or to get it out to the public that this was not being heard, that this was being suppressed. I learned 3 kind of principles that we're going to need to follow if we want to get a single-payer system. And the initials are ICU. So I think about, we're in a healthcare crisis. We need ICU. But it doesn't stand for intensive care unit. It stands for independent. We need to build an independent movement. One that's not allied to political parties so that it doesn't compromise based on that political party's agenda. One that says, we're going to keep pushing on you no matter what till you do the right thing. We need clarity. We must educate ourselves about what works and what doesn't work, because, to put it quite bluntly, we're outright told lies. After the Affordable Care Act passed, the members of Congress were going around and saying, "Oh, it's universal, it's guaranteed, it's affordable." It's none of those things. It's called the Patient Protection and Affordable Care Act, and it doesn't protect patients, and it's not going to lead to affordable care. So we have to know what actually would do that so we don't get fooled. And the third thing, is uncompromising. We have to stop settling for crumbs. Our people across the... People in other countries don't settle for what we settle for. And we do. We accept it. We're told, this is what's on the table. These are your choices. And we know they're not adequate choices. But we accept them because we're told that's all we can get. So we really have to stop doing that. So I really want to get on to questions and hear from you about what your concerns are, because there has been a lot of misinformation out there. The corporations are really good at doing that. And Wendell Potter, who left his job at Cigna and wrote Deadly Spin, has been a very helpful person in exposing that. But organizations that are continuing to move forward. Can you hear me? We have sound? Okay. The organizations that are continuing to push for this are Physicians for National Health Program. We are a 501c3. We educate and advocate for single-payer health care. We publish in peer-reviewed journals. And our doctors, we're all volunteer, except for a small staff in the office in Chicago. We all work volunteer to do this. Healthcare Now is our sister organization. Healthcare Now is a national grassroots organization. They've had a campaign going on the last year or so called Hands Off Our Medicare, and they've really been pushing on Congress. They did a campaign called Don't Cry for Me, John Boehner. one, they gave him a tissue. And the other group that I'm involved with that's not an organization is something called the October 2011 movement. Because what I want to see in this country is actual health, a healthy population. And actually only 10% of our health is determined by health care. 90% of our health is dependent on what are called social determinants. And those are education, housing, having a job with a living wage, being treated with dignity, living in a clean environment, an environment that's safe from violence, having access to clean water, having affordable, healthy food. These are all things that have an impact on our health. So if we just fix access to health care, we haven't done the job. And the healthcare movement alone is not big enough, unfortunately, to take on the corporate forces. They have the money, but they don't have the people. Like 4%, what is it, 400 people in this country have the same wealth as 154 million. Like, why aren't that 154 million out there saying, this is not right? So, and I could go into that, but our wealth inequality in this country is really, it's growing, and it's leading to, if you look at all the indicators of social well-being, we're off the chart in a negative way because of our wealth inequality. So the October 2011 movement came about from individuals from various advocacy groups who advocate for peace, social, economic, and environmental justice. We insisted that no organization could be in control of this. It had to be individuals, but we have over 150 organizations that have endorsed. And we're going to join forces to use whatever it takes to get the change that we need. Our slogan is human needs, not corporate greed. So we'll employ... mechanisms of nonviolent non-cooperation with the system and mechanisms of policy and pushing for solutions. Things like democratizing our economy, which would go a long way to put more of the power into the hands of the people and benefit more people. So that's a new movement. It kicks off on October 6th, and if you want to learn more about that, you can go to october2011.org. But thank you very much for letting me speak to you tonight, and I'm happy to take questions.